Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I've been a cardiologist for 40 plus years, and this is a series of lectures on your heart. The focus of this presentation is red meat good or bad for healthy heart? Or I should rephrase it, is too much protein? If you look at the amount of meat consumption here in the United States, you shouldn't be surprised to see that the US population consumes 100 to 125 kgs of meat per year per person compared to all other countries. Brazil, Canada, UK are the only ones that come close to the United States. And of course, in India, the beef consumption is almost very, very minuscule, and so is Kenya. If you look at the heat map, it will clearly show you the countries that consume the highest quantity of meat: the United States, Brazil, England, and Australia, and some parts of China. And if you look at the breakdown of the source of meat, beef accounts for a majority of it. It used to in the 1970s. The quantity of beef used has come down to some degree, but still you're talking about like 30-40 kgs of beef per year, followed by pork, which is smaller of the three groups, and poultry has gone up in the past 40 years or 50 years, and as you can see, the poultry has increased in quantity. And one thing that's not mentioned here is the fish, which is an important source of protein and also poly and monounsaturated fatty acids compared to highly saturated fats found in beef and pork. You also find some saturated fats in poultry, but not to that extent as you see with beef. Annals of Internal Medicine in 2019 did a meta-analysis of 54 studies comparing the effect of meat on cardiovascular risk factors. Their overall conclusion was that it did not show a significant increase in cardiovascular risks. But however, when they looked at different subgroups of population, like those who consumed processed meat, I'll talk about the difference between lean meat versus processed meat in a few minutes. People who had taken processed meats on a regular basis were at a higher risk of heart disease. Those people who consumed high quantity of meats also had an increased risk of heart disease. So not only are we concerned about the quality of the meat that you consume, as you can see, here's a highly fat marbled piece of meat compared to a lean muscle mass here, along with these processed meats, which are like sausages, sandwich meat, and ground beef, which is high in saturated fatty acids. In addition, in the United States, we have the highest quantity of meat consumed per person compared to most other countries. The three predominant meat sources are, of course, as we said, beef, pork, and chicken. One of the things which is missing here is the fish, especially salmon, which is supposed to be very good in terms of having high levels of poly and monounsaturated fatty acids, which helps to lower cholesterol level and also reduce cardiovascular risk. One study concluded that there's an increased risk of heart disease and stroke by 16% among those who consumed red meat. And a second study looked at those people who consumed more than 100 grams of red meat. So this was about just meat, and this is about the quantity of meat, increased the risk of heart disease and stroke by 10 to 20%. So there is a correlation between meat and saturated fats and an increased risk of cardiovascular disease and stroke. Let's look at some of the red meat cons. Number one, they contain too much saturated fat. All that white or yellow layers that you see besides the muscle fibers is all fat, and most of it is in a saturated form. Of course, they add high fat calories. Essentially, meat provides no fiber whatsoever. And in addition to that, we also have additives and chemicals in processed meats. When someone consumes a high quantity of protein, it can lead to kidney damage. And of course, we talked about the higher incidence of heart disease. In addition, people who consume high quantity of meat are also prone for cancer, diabetes, and decrease in lifespan. Besides all this, it increases greenhouse gases. The goal of using red meat in our diet is one, it provides an excellent source of protein. It also provides minerals like zinc, which is an important element, and vitamin B12. The bad side is, of course, the saturated fat. The saturated fat intake should be like 7% of the total calories, or if you are on a 2000 calorie diet, it should be like 13 grams, but that 13 grams of saturated fat can be easily exceeded by half a pound of meat which is marbled with a great amount of fat. The general recommendation is to use no more than 4 to 6 ounces of meat protein per day. It is also recommended that you use fish instead of red meat at least 2 to 3 times a week, such as salmon or mackerel, which are high in poly and monounsaturated fatty acids that reduce cholesterol levels. And the processed meats are all the ones that you see here in this diagram, like pepperoni, sandwich meat, ham, and sausages, and all this like ground meat. All these are processed meat, bacon. They are extremely high in saturated fat. If someone were to consume 50 grams of processed meat, that is little less than 2 ounces of processed meat on a daily basis, it increases the risk of heart disease by 40%. And a lot of it is related to the saturated fat and also the amount of salt used in preserving these meats. So every time you open a packaged meat, most of which are processed, you can see what the fat content is, how much saturated fat is there, and more importantly, see how much salt is there. And when you look at these things, you realize that you are taking the worst kind of meat possible. And even that, you may be thinking that, well, all I'm having is a little ham and turkey sandwich, but you may be getting a lot of salt and processed saturated fat. Here is an example of your processed meat. In a grocery store, when you look at all these packages, just look at their fat content, saturated fat content, and the salt. When you add up all those things, you realize this is not the best kind of meat you want to have compared to a lean, small 4 to 6 ounces of filet mignon. So what is the best way to modify your meat intake? First thing is to use lean cut meats. Minimize processed meats as much as possible. It is so easy to put 2 slices of bread and 2 slices of ham or salami, and then you don't even know how much salt and fat you're getting. Use meat as a side dish instead of using it as the main course, like having a 18-ounce Del Monte steak. On top of it, you pour butter, and then you have a truckload of French fries on the side. That's a recipe for disaster. Most of the Mediterranean people who have the lowest incidence of heart disease, they restrict their protein meat intake to less than 4 ounces per serving and perhaps no more than 6 to 8 ounces per day at the max. We should not be using meat for every meal, for breakfast, for lunch, and dinner. Maybe one of the meals should be replaced with vegetables, salads, so that you cut down the amount of meat and the saturated fat you get. Of course, we can supplement them with vegetables, nuts, beans, eggs, which have less amount of saturated fats. So, ladies and gentlemen, there is another option that is available, and that is replacing meat with meat substitutes. As you can see, the amount of meat substitutes have grown significantly, especially in Asia. And as you can see, almost $20 billion worth of meat replacements. Now you have a meatless burger, you got meatless nuggets, whatever you want, meatless hamburgers, whatever you want, you can get. So, ladies and gentlemen, this is a quick overview of meats and their effect on your cardiovascular system, longevity, and what is the right kind of meat and how much meat you should be consuming on a daily basis. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. We have a series of lectures on how to stay heart healthy, and I would recommend you to watch those. I am Dr. Nik Nikam from Houston, Texas.